This presentation, titled The Future of Food Safety Auditing in the Healthcare Sector, comes to us from Dr. Vasambal Manikkam. Vasambal has a profound interest in the science of food, nutrition, global population health, and food safety. She currently works within the healthcare sector and is also a food and nutritional consultant working globally. Vasambal is often invited as a reviewer for research papers from internationally recognized scientific journals based on her expertise. And with that, take it away, Vasambal.
Thank you, Mike, for the introduction. I would like to begin by acknowledging the traditional owners of the land where I am today for this virtual presentation. I would also like to pay respect to elders past and present. As we must all be aware that the healthcare sector is a fast-growing industry comprising of important settings such as the public and private hospitals, aged care sectors, retirement villages, and so on. They deliver primary to tertiary level of care to varied target groups of people who are the most vulnerable. Within this sector, a vulnerable individual means a person who needs assistance, who needs to be looked after, and who immensely depend on the health care and help of healthcare professionals for their survival and well-being. They also depend greatly on the food service subsector for their everyday meal preparation, delivery, and service. This is how, why, and where food safety and food safety auditing come into play and form a fundamentally important aspect that need to be considered at all times within this sector. So why is it that we need to be considering food safety auditing and food safety within this sector? Well, the vulnerable people are target groups who are often immunocompromised with weakened immune system and of course depletion of antibodies. So this means that they are more easily prone to different kinds of infectious diseases, and of course they will be at higher risk of developing foodborne illnesses. Therefore, if food safety is in any case compromised, or if there is a food safety hazard in such settings, it can actually be life-threatening, as most of us will be aware of. So again, why food safety and the healthcare sector? This is because if we are closely considering the future trends in the healthcare sector, we would notice that in Australia especially, it is currently expanding at a speedy rate. In fact, based on a research report published by Deloitte for the Royal Commission into Aged Care Quality and Safety, it is expected that there will be an increasing prevalence of chronic diseases and aging population. And also it was noted that there will be tremendous changes within the healthcare models in the next few years. It was also mentioned that there will be a higher tendency of mental health issues, mainly dementia, in the elderly population. So what does this mean? This means they would definitely require care, and it also means that the demand in aged care facilities might be increasing rapidly in the next 20 years, and hence the food demands would eventually rise proportionately. Here comes the requirements for food safety, which would be increased as well. This corresponds to the fact that it would be even more critical for these settings to have approved and implemented food safety standards, food handling protocols, and continuous food safety training to protect the livelihood of the people. As a matter of fact, in an Australian context, of course, there are legislations and requirements in place to protect the well-being of those who are vulnerable. For instance, we have the Western Australian Health Department the New South Wales Food Authority. As we must be knowing by now, each state has their own department, but the regulations are governed by Food Standards Australia New Zealand, also known as FSANZ. So according to FSANZ, any organization and or food businesses that are involved in food preparation and or processing, food handling, and service to vulnerable people in the aforementioned settings must definitely comply with the food safety standards contained in Chapter 3 of FSANZ. The Standard 3.3.1 under Chapter 3 relates to food safety programs for the service of vulnerable people. Here I quote that the standard states that it is compulsory that businesses like hospitals, such as the chemotherapy facilities or psychiatric centers, aged care centers like the nursing homes or respite care, as well as child care, such as long day care or family day care. These settings and facilities must implement a food safety program. This is particularly important in places where the food is potentially hazardous and of course ready to eat. If we look at the New South Wales Food Authority, they have actually prepared specific guidelines for food service to vulnerable people to help these organizations prepare a food safety program that will actually comply with the NSW Food Regulation 2015. For instance, the guidelines include specific elements of a food safety program that will be verified and assessed during certification and auditing. It also provides control measures to demonstrate compliance against standards and protocols. It also emphasizes that each and every organization that deal with food handling or processing and production must be HACCP accredited. HACCP means Hazard Analysis Critical Control Point. On that note, I must lay emphasis on the fact that it is our duty as professionals with expertise in the field to protect the well-being and health of the people in need, especially if we consider the senior citizens. So what could possibly happen if we compromise food safety in these settings? As we are talking about currently, it's about vulnerable people. So they are more prone to infectious diseases, as we have spoken so far. So let's firstly look at salmonella outbreaks, which is representing a common consequence of neglecting food safety. I have provided 3 examples here in Melbourne, New South Wales, and Adelaide, where we can see in each of these cases, we've had death, we've had residents being affected who has been hospitalized and fall ill. And these are due to lack of food hygiene and neglecting food safety within those departments. So the consequence is pretty intense, and we have to be very careful when we are dealing with food in these sectors. Another consequence of compromising food safety is listeria food poisoning. An example, a very recent example, is in 2019, where 1,000 of Meals on Wheels products were recalled due to reported listeria food contamination. In fact, as we can see here, the example of the food products involved were potentially hazardous. And similarly, in Queensland Children's Hospital, commercialized lamb ham contamination with listeria was reported. Currently, the food industry is experiencing food globalization and adulteration that are increasing the risks of allergen contamination throughout the world. It is very important that in the healthcare facilities or healthcare center to minimize allergen contamination. And I will emphasize here that it is indeed the responsibility of each and everyone to prevent cross-contamination from the 8 different sources of food allergen that are very well known during food preparation. The health consequences of consuming a food contaminated with a particular allergen by those who are allergic to that component can be actually lethal. As demonstrated here, the distribution of gluten-free ham and cheese toast to a primary school resulted in a child being impacted by an anaphylactic reaction because it was reported that the bread that was delivered was actually a non-gluten-free bread. So it is very serious. It must be treated with a lot of diligence and care to protect public health in all aspects. My question here to the audience would be, how are the different departments within the healthcare sector are protecting their patients and residents against the side effects of food allergens, and or how are they preventing reactions? The other question I will leave for the audience to think over is also, where are the due diligence as well as training and possibly safety standards within that particular company and beyond? In a nutshell, I would say that these are some factors that possibly future food safety auditors must be considering during their audit. Before I move on to the next section, I would like to emphasize here that it is the full responsibility of all staff, including nurses, nursing assistants, caregivers, food handlers, and any other personnel who are directly involved in food handling, to ensure completely safe and hygienic practices when specifically dealing with any type of food. So this brings us to the concept of food safety auditing and why is it important. I guess by now we will all have a pretty clear idea why food safety auditing is, and what is the importance of food safety auditing. First of all, I would like to say that it is integral in certifying that proper and adequate food safety practices are being abided by different departments within that specific sector of healthcare. It is to protect public health while still verifying if institutions are being complied with standards and legislations. The most important thing is really to protect public health. It is important to prevent any occurrence of food poisoning, foodborne illnesses, which of course fall under protecting public health again. Another aspect of food safety auditing is not only protecting public health, but also protecting the reputation of that specific company or organization dealing with food service, dealing with food delivery, dealing with food preparation. As I have mentioned in the previous slide, that company who was providing sandwich to primary school actually got fined $30,000, and those food must have been recalled, and it's a big loss for the company as well. So in regards to food safety auditing, it is to make sure that companies are safe, are financially safe, and as I say, to protect public health. It is also important to ensure that sanitation program and cleaning schedules are in place and that all staff are fully trained and are involved in ongoing training. So another importance of food safety auditing is to ensure that all this training regarding to food safety, regarding to food hygiene, sanitation and cleaning protocols are in place and staff are being trained and certificates are being proven when required. So in a nutshell, this is some of the importance of food safety auditing within this specific sector. So of course, it is the food safety auditors who will be conducting those audits. And in order to achieve effective and productive auditings, it would be important for food safety auditors to have several skills, experience, and attributes, as well as qualifications and technical expertise in the field. So one of the important roles, like I said, food auditors must be able to verify compliances with criteria, requirements, and legislations. So basically, an auditor must be able to perform and make decisions independently. It is very important not to be biased or involved in conflict of interest when conducting an audit. Their data must be clear, concise, and precise. And of course, evidence-based, well documented and presented. To achieve well documentation, presentation, and presenting the data based on evidence, they must have an eye for detail. They must be exhibiting an ethical behaviors, having a critical mind, and being observant, as well as curious with an ability to ask intelligent, open-ended questions. In return, this will facilitate relationship between industry and auditors and also gather data in a diplomatic approach. Of course, there are other important skills that would facilitate an auditing efficiently and effectively, and those skills include communication skills, liaising between different partners within the industry, negotiating, writing, and how to write an audit report, how to interview employees working in the food sector, how to be actively listening to what's going on within the department. They must also have a thorough comprehension of the Food Safety Act, of course, as I mentioned, the food safety standards, for example, the BRC or the SQF, and also they definitely need to have adequate amount of knowledge about the industry they're involved with. And without forgetting due diligence, integrity, confidentiality of data and reports. All right, their attributes and skills and experience allow the auditors to fulfill certain important tasks and responsibilities. I will not go through the whole list of responsibilities because it does vary from industry, from different sectors. So in a nutshell, it could include that an auditor must be ensuring that non-compliance from a previous auditing, for example, has been cleared. They must ensure that there will be evidence of regular cleaning and sanitizing schedules. They must also ensure that there is evidence that the kitchen equipment maintenance are being conducted on a regular basis. Now, if we consider the hospital, for example, and or aged care facilities, patients and residents will often have different food requirements. Their food requirements may be changing on a weekly basis, on a monthly basis, depending on their health status. And these food requirements and their drink list and the allergen records must be updated. And so therefore, one of the responsibilities of an auditor would be to ensure that these information are in place, are dated, are up to date. And I would say one of the most important responsibility and task would be for an auditor to understand the scope of their audits before they actually go to their auditing site. And of course, using a comprehensive checklist to gather sufficient relevant data that they require during their auditing. And yes, they need to verify compliance. They need to point out corrective actions if there is any towards the responsible person and personnel within the department. So in regards to auditing checklist, of course, there is a whole list of information that they would need to go through. A few of them would be, for example, what are the safe food temperature? Is that particular place that's being audited are adhering by the safe food temperature? Are there fridges and temperatures within that department? Are the temperature are maintained accordingly? Do they have a food allergen record, like I mentioned before? They will also have a labeling and traceability checklist. This will include how pre-prepared food, for example, and or perishable food items, how are these being labeled and stored? Are the labels including the name of the actual products? Do they have a date of purchase? Do they have a date and time of preparation? Do they include a use by date? So all these kind of small details, small information needs to be available, needs to be looked into. They would probably also have a checklist where they would be investigating if the food are stored in a rotation use by date basis. These are very simple items that needs to be looked into, but they are very important if they can be very consequential if these little details are not being looked into during in the kitchen during production, during preparation, So they must also look into pest control, for example, how the organization is managing waste, personal hygiene, non-conforming products, and of course look into previous complaints, probably complaints from patients, complaints from residents. How are these complaints being addressed and what could be done in the future to prevent those complaints? I would like to point here that the most important 5 questions to ask before, during, and after an audit include the how, the what, the where, the why, and the when. Again, I will leave it to the audience and the professionals out there to reflect over these important questions. They may seem very basic, but they are very important that when asked, they will give appropriate information during an audit. And so I'll leave it to the audience and the professionals to think about bringing such concept to their next audit if they're not yet doing it, especially those who are starting fresh in their career. All right, so that brings us to what holds the future of food safety auditors. In this regard, it is becoming certainly an important objective to establish a minimal baseline of competitors and auditors to assess their credibility. Of course, their code of conduct, besides their technical and educational qualifications, must be well established. Actually, there is an exam that's being released by the GFSI that actually assesses the auditor's knowledge across a wide range of skills. For example, the potential of writing an audit report. And an example could be, how do they interview employees during an audit? Another example could be, what are they looking at? What are their scope? What are their purpose? Do they understand that aspect of an audit? In the future, it must be the aim of the auditor to add value to the food safety system of the organization they are evaluating. It is very important to have this communication to not only find the non-compliances, but also to add the value. And it will also become very critical for food auditors to be certified in a competency-based National Food Safety Auditor Program through Exemplar Global. In the era of COVID-19 and possibly other pandemics, it would be necessary to change the mentality and mindset from one audit per year to an improved food safety culture across the whole year. As we all know, last year the world has experienced many changes due to the COVID-19 situation. If we look at WA Western Australia, for instance, the government had to suspend and reschedule many food safety audits due to the social distancing restrictions, and of course to protect the vulnerable patients as well as staff. But still, it was a must that all documents and data must be maintained and would have been made readily available when audits would recommence. To avoid any compromise of audits in the future, food safety innovations would be necessary, especially to meet the COVID-19 challenges and possibly other pandemics that's coming along the way. So here, as innovations, we are looking at on-site virtual and remote virtual auditing. That is not so new. Last year they've been doing it, and I guess it will be becoming more prominent as we go through the era of COVID-19 and possibly other viruses. It will also be important to encourage sudden and spot checks and conduct unannounced audits. So this brings us to what needs to be changing in the future. Again, I would say communication, engagement between food safety auditor or food regulator and employees within the organization. I feel it is best practice to engage more with employees during interviews that will provide different insights and help them building a stronger food safety within the company. I would also emphasize on the fact that there will be an urgent need to switch from paper-based recording of information and data to digital technology if certain facilities haven't done that yet, especially in fast-paced environment. Such as the main production kitchen within the healthcare sector. Possibly wireless sensors, handheld devices, and why not smart glasses could be beneficial in the future in terms of reliability and, of course, eliminating human error within those sectors. So finally, I'd like to briefly touch on career pathways of food safety auditing in the healthcare sector. From my personal experiences, I feel it's a privilege to be in that profession of auditing. And also I've noticed how organizations are stressing about an upcoming audit. Well, as professionals in the food safety field, I must say that we're not here to intimidate or put pressure on organization. We are here purely to make sure that the company is safe, public health is maintained, and food is being safe. we are here to avoid any unnecessary expenditure, such as on fine, on food recalls, and to be able to ensure that these are happening, we must be aware of the competencies and qualifications, as well as certification and registration bodies beyond educational and technical qualifications, which are all necessary to be able to fully perform in this discipline. Professionals who are new to this field would need to be knowledgeable in the principles of hazard analysis, critical control point, which is HACCP, principles of food safety auditing, of course, the standards, and why not considering a degree or master's in food science and technology. That will be of great advantage, and of course, fully understanding the concept of food microbiology and innovation about the future of food, what's changing within the food industry, and whatnot. A career can be started as an internal food safety auditor and or external auditor who works for an agency or the government. So they will be the ones who will be auditing against legislations. There is also what is known as third-party auditor, and this is food for thought. On that note, I hope you find the presentation insightful and helpful, and I thank Exemplar Global for this opportunity to present and the international audience for listening. Thank you.
And thank you, Dr. Vasambal Manikkam, for that look at food safety auditing within healthcare. And that concludes this presentation.